Welcome to Too Fond of Books. My name is Janelle and I am really excited today because this is an announcement video. For the month of May, I am privileged to be co-hosting the Global Nurses Month Read-Along. Now, this was created by Awhona at Hamzavahini Vuchu who is, I just love her. She's a fantastic booktuber, and for the past couple of years, I've been participating in her Florence Nightingale read-along that she has in August, and she asked me if I would co-host this read-along with her and another booktuber called Kirby the Bookish Nurse. And I was so pleased to be asked, and so let me tell you what this read-along is all about. May is Global Nurses Month, and especially with the past 2 years we've had, I think that it is really fitting to do something that highlights nurses, that offers us as readers an opportunity to learn more about what it's like to be a nurse, and to just show some appreciation for this group of people who have a really difficult job and who really do deserve our respect. My mom is a nurse, and so I grew up with a mom who was a nurse, and I don't remember all the different roles that she played as a nurse. I think at one point she was a nurse in the emergency room. I know that she spent some time as a home care nurse. So yeah, I grew up as a nurse's kid, and I have two cousins who are nurses as well. They're in the neighboring province, and they're sisters, and they're both nurses, and one of them is an oncologist nurse, and over this past year I have spent a lot of time with oncology nurses, and I have such a huge amount of respect for them. They have a really difficult job, especially with the past 2 years with this pandemic. They have a very difficult job, but the nurses that I've been in contact with anyway are hugely professional, are very friendly, are very competent, and deserve our respect. So I'm really excited to be involved in this readathon. So, in order to participate, we're asking that you read 2 books written by nurses, if at all possible. And to make it easy for you, we have come up with a list of 8 books, and we've divided them between the 3 of us as hosts. And Awhona has set up a Discord group, and I'm going to put the link for it in the description box below. And so each of the books has a spot on the Discord group to discuss. So you can hear all your options and choose the book, or we would love it if you would read 2 from this list. And then you can join us and discuss them. So what we've done is we've split them up between us. So Awhona is reading 3, I'm reading 3, and Kirby is reading 2. And we will discuss them with you guys on Discord. And I think that's great. So Awhona is reading Saving Lives, Why the Media's Portrayal of Nursing Puts Us All at Risk by Sandra Summers, RN, which highlights the essential roles nurses play in contemporary healthcare and how this role is marginalized by contemporary culture. Sounds really interesting. She's also reading, she's also reading The Courage to Care, Nurses, Families, and Hope by Christie Watson. And then her 3rd book is COVID-19 Frontliners Against All Odds by Maricia Chavez, Eileen Diaz, and Dan Gustafson. This book holds the stories of 9 nurses from across the United States who volunteered to work in New York City hospitals during the peak of the pandemic in 2020. So, to get more information about those 3 books, please visit Awhona's channel, Hamzavahini Vuchu and watch her announcement video. I'm sure she'll give more information about her 3 books. Kirby is reading Ghosts of the NHS and Other Spirits I Have Known by Glynis Amy Allen. This one sounds really interesting. The author is a nurse, and she talks about ghosts that she's encountered in her profession. So yeah, that one sounds really interesting. And then the other book that Kirby is reading is Year of the Nurses, a 2020 COVID-19 pandemic memoir by Cassandra Alexander, RN. And I'll put Kirby's channel in the description box below as well. Please go watch her announcement video where she'll talk more about these two books as well. The three books that I am reading are A Matter of Life and Death, Courage, Compassion, and the Fight Against the Coronavirus on the Front Line by Kelly Critcher. This is a palliative care nurse's story. As a palliative care nurse, it is Kelly Critcher's job to look death in the eye, to save a patient while the fight can still be won, and confront life's end with grace and kindness when it can't. In early 2020, everything changed for nurses on the NHS front line. Working on COVID wards in the high dependency unit, Kelly spent the height of the coronavirus crisis at Northwick Park Hospital, perhaps the UK hospital most deeply ravaged by the illness. Her story weaves together her raw emotional diaries from the COVID frontline with reflections on a life spent caught between battling for her patients' lives and helping them face down death with courage and compassion. Bringing together the enormity of the last 12 months, the scars it will leave, and the lessons it can teach us, this is a book for our times. So this is one of the ones that I will be reading. If this sounds intriguing to you and you can get a hold of a copy, I would love to have you join me. I will do a video talking about this book once I've read it, but I will also be discussing it on Discord. So I hope you will join me. This one sounds really interesting. The other book that I am reading is A Nurse's Story, Life, Death, and In Between in an Intensive Care Unit by Tilda Shilof, I think. A teenage boy is struck down by a cerebral aneurysm and his parents are faced with a dreadful decision. A mother pulled from a burning house is resuscitated and survives, but her child dies. A lung transplant makes it possible for a woman to breathe easily after years in which breathing was agony. These stories are part of what happens in a big city hospital's intensive care unit. Patients whose lives are imperiled either by accident or disease are treated by cutting-edge medicine and expert nursing care. The nurses Tilda Shilof works with in the ICU are smart, funny, curious, caring, and incredibly dedicated professionals. Laura's keen mind and skillful hands, Frances's wise and loving heart, Justine's political savvy and outrageous moxie, Nicole's kindness and courage, and Tracy's generosity and intuition create the bonds of a powerful team and an intimate friendship. Shilof's career as an ICU nurse begins with self-doubt and apprehension. Just to acquire mastery of the arterial stopcock, a valve in a line that gives the medical staff instant access to a patient's circulation, requires time and courage. But Shilof never gives up, and her colleagues never stop supporting her. They see an enormous variety of patients. Beside the many who are terminally ill, there are organ donors and transplant recipients, accident victims, and people with dangerous new infectious diseases. Her profession constantly presents challenges and problems. The partner of a man who dies in a motorcycle accident wants to salvage a sample of his sperm. A nurse makes a point of washing the hair of a woman who won't survive another day. A wealthy family squabbles over their dying father's fortune, even as he fades away. Shilof learns to treat both the patients and their families. To do so effectively, she needs self-knowledge as well as technical know-how. Guided by her colleagues and motivated by her ideals, Shilof eventually achieves her goal. She conquers herself so that she can serve others with compassion. In this funny, sad, entertaining, and insightful book, Shilof reveals the world behind closed hospital curtains. The vulnerable human moments, the surprisingly joyful camaraderie, the big issues, and the small are all brought vividly to life. And the one thing that attracted me especially to this book is that the author is Canadian. She works in a Toronto hospital. I believe it was a Toronto hospital. So it's a Canadian nurse's story. So if this one sounds interesting to you, this might be one of your picks, and I would love to have you join me read along A Nurse's Story. The third book that I will be reading has not arrived yet from the library, so I'm going to put the picture in here. It's called Rituals and Myths in Nursing, A Social History by Laurent. Nursing is a complex profession steeped in tradition and history. Tried and tested ways of working have been the mainstay of how and why nurses do what they do. Completing tasks in a certain way because sister says so describes the custom and practices of nursing. passed on through the generations that existed for most of the 20th century and can still hold sway today. Science and evidence-based practice have weakened the hold on tradition, but ritual is still part of the fabric of nursing. Packed with amusing and sometimes poignant reminiscences, this book paints a picture of nursing from the first registration of SRN number 1, Ethel Bedford Fenwick, in 1919 to the present day. Each chapter follows a theme, explores the historical background, and brings it to life with stories told by nurses from different eras. We have tales of alcohol prescribed to dilate blood vessels or simply for the feel-good factor. Enemas were less fun, given for almost all bowel conditions. High, hot, and a hell of a lot was the phrase for remembering this ritual. Written with humor and a light touch, readers don't need a nursing background to enjoy these stories, but those who trained as nurses will identify with many of the amusing and often eccentric traditions retold by generations of nurses. So those are the 3 books that I will be reading. And so all you need to do to join this read along is to choose 2 books from that list and join us. It's going to be a lot of fun. There are a few other optional things that you can do. An additional challenge is to read any one book based on true life stories or inspired by nurses who have contributed immensely yet are lesser known in today's world. So this is an optional challenge, and the author may or may not be a nurse but has written about them. And the book that I've chosen for this, and you can read it along with me if you like, is called The War Nurse by the author's name is covered by a sticker. One second. Tracy Anderson Wood. Superintendent of Nurses Julia Stimson must recruit 64 nurses to relieve the battle-worn British months before American troops are ready to be deployed. She knows the young nurses serving near the front lines will face a challenging situation, but nothing could have prepared her for the difficulties that await when they arrive at British Base Hospital 12 in Rouen in France. The primitive conditions, a convoluted supply system, and horrific battle wounds are enough to discourage the most hardened nurses, and Julia can do nothing but lead by example, even as the military doctors undermine her authority and make her question her very place in the hospital tent. When trainloads of soldiers stricken by a mysterious respiratory illness arrive one after the other, overwhelming the hospital's limited resources and threatening the health of her staff, Julia faces an unthinkable choice. Step outside the bounds of her profession and risk the career she has fought so hard for, or watch the people she cares for most die in her arms. Based on a true story, The War Nurse is a sweeping historical novel by Tracy Anderson Wood that takes readers on an unforgettable journey through World War I France. That just sounds really interesting. So for this optional challenge, we're asking you just to find historical fiction or fiction that are based on real life events or based on real nurses. So there's a lot of options out there, and this one just sounded really, really interesting. The third option for you, and this of course is again just to add fun, is to read some fictional books based on nurses, where a nurse is the protagonist, or it's based around the nursing field. And I have some books coming in from the library, and I'm going to do a separate video about the fictional books that I will be reading for this read along, so stay tuned for that. And then the fourth one is also optional and just for fun, and that's to watch a series or movies based primarily on nurses. And so there's also a section for this on the Discord group where you can recommend shows or movies that you've enjoyed that highlight nursing, and we can talk about them together. A few of my favorites are Call the Midwife, which is set in England, in London, in the 50s and 60s. Primarily about midwives, but there's nurses as well, and that is such a great show, and I love how much history they've included in that show. Another favorite is The Royal, which coincidentally also takes place in the 60s in England, but it's up north, it's in Yorkshire, and it's set in a hospital called The Royal. It's a cottage hospital, and It's not just about nurses, but nurses are some of the main characters in that show about life, basically about life in that hospital in the 60s. Also a really interesting show. There's another show that I learned about that I have access to on BritBox, and I haven't watched it yet, but it's called Frankie. Frankie Maddox is the electric, quirky, and vibrant lead district nurse at the community nurse's office in Bristol. So it's a TV show where the main character is a district nurse, and that just sounds really interesting as well. So there you have it. In order to participate, we're just asking that you read 2 nonfiction books, but to make it more fun, and because it takes place during the whole month of May, we've added a few other fun options as well, including some fiction and some TV shows. So would you consider joining us for Global Nurses Month Read Along? I will put all the information you need, including a link to the Discord in the description box below. Please go and watch Awhona's video and Kirby's announcement video, and consider joining us for this really fun read along. So let me know in the comment section down below if you are thinking about joining in, and I will see you for another video soon. Bye.